Okay, so now we're going to move on to the deeper muscles. These are harder to differentiate, but we're going to do our best, okay? And it doesn't actually, you know, it's not the end of the world if you can't tell the difference between the front and the back and the different fibers. Again, there's a whole lot of therapists, and certainly most people in the world have no idea about the difference. So I'm introducing these concepts to you. I suggest that you connect with a good pelvic floor physical therapist if you want to dive deeper into what's going on with your different muscles. But here you can see, this is again that view from below. We have this easy view of the pelvic floor muscles. Here's the easy view. Here's the harder view, but these are the deeper muscles, okay? So they attach behind the pubic bone and then they stretch. Some go back to attach to the tailbone, some link around here, okay? A different view for you here that I thought might be helpful as we're thinking about the deeper layers, because my whole point here is to connect you with your pelvic floor muscles. So that's why I'm giving you so many different views, so many different models, and so many different landmarks, because I really want you to have a good connection and at least a good introduction to your pelvic floor muscles. Okay. So this would be looking into the pelvic floor, like if we had this bowl and we're at the front and we're looking into the bowl like this, okay? Here's the pubic bone in the front, here's the tailbone, and these are the three canals. So the brown canal is for poop, so that's the rectal canal. The pink canal is the vaginal canal, and then the yellow canal is the urethral canal. Of course, in real life, they don't exactly look like this, but this is an illustration that I hope helps to kind of connect you. And you have pelvic floor muscles. Here's the pubic bone. So you have some that connect here, and then they actually sling around your rectum and come and attach to the other side. You have some that actually kind of sling around the vaginal canal. You have some that come back here and attach more here at the tailbone. And then there's the other side. These are also pelvic floor muscles. So these kind of go out more like in a fan shape. And in a minute, we're gonna do the hip tension and pain test. And I talk about the obturator internus in that test. This is the obturator internus. So with a skeleton and some Play-Doh, I'm showing you the obturator internus, but here is the obturator internus. So here's the pelvic floor muscles. This is actually a hip muscle that attaches inside the pelvis. And so why that's important is if you're having hip pain or any kind of dysfunction here or out here in the hip, this could be the obturator internus, or if you're having pain in the pelvis or in the pelvic floor, this could also be the obturator internus. And you can see they share this border. It's kind of like two countries. So this is one country, this is another, and this is the border in between that they share. You also have some deeper pelvic floor muscles that wrap around the urethra, that urine exit canal, that are really not visible here. So just understanding that those do exist. We're not really going to be self-checking those specific muscles. Those are really much harder to access, and it takes more of a skilled hand to be able to feel those, but they do exist. We're going to do one more view here. So this is a view from the side. So this is that female body that's cut in half. This is the belly in the front and the bottom in the back. We have the pubic bone and the tailbone and the spine. Here's the glans clitoris, and then you have the urethral canal where urine exits, the vaginal canal, and the rectal canal. And you can see how there are muscles that wrap around each of these canals that really aren't visible in that other view. And you're not going to be able, in fact, you know, you're not going to be able to feel this canal and feel these muscles. And this is really kind of the illustration. This isn't even specifically anatomically accurate, but the concept exists that you have muscles that wrap around each canal. And then here are the pelvic floor muscles that connected the pubic bone, stretch back to the tailbone. And then those deeper muscles that I was just showing, the fan-shaped one here. And then here's that deep hip muscle, the obturator internus. So remember how I talked about two countries. Here's one country, here's the other country, and then we have the border in between. And then here's some of your other deep hip muscles, like your piriformis up there. So that's the orientation of the deep muscles. Now let's go over how to check them. So remember our modified Oxford grading scale that we talked about, and that's the vaginal opening. So you'll insert a finger into the vaginal opening, and I would suggest you, if you have vaginal laxity or a vaginal canal that has more movement in it, then I would suggest you kind of rest your finger on the back part of the vaginal canal. If you have pain, I'm not saying don't do the check, but I don't like you to do anything that's causing yourself pain. So if you have pain with insertion, there's a lot of things that you can do externally. There's a lot of things that you can do with your hips. We're going to go over some other interventions throughout this, some stretching and some massage and other techniques to help with pain. So it's really your call. But I'm not advocating that you cause yourself any pain. Okay. So doing that self-check, so you're inserting the finger into the vaginal canal and you're going to squeeze. When you squeeze, you should feel, we want you to feel pressure around the finger and that finger being pulled up. And remember that scale, 0 to 5. So how do you rate? And this, we're checking the front part of the deeper pelvic floor muscles right now. Okay, so that is the first, that's the strength testing part. So you're going to test the power, you'll test the endurance. So how well do you hold? You'll test the number of repetitions. So when you squeeze, and let's say you held it for 4 seconds, how many times can you do the 4-second hold? So let's say you squeeze 4 seconds and relax. And you're able to do that 5 times. So that would be 5 times 4 seconds on your pelvic floor tracker. It would be, the lift endurance would be 5 repetitions. And the lift endurance number of seconds would be 4 seconds, right? How many quick squeezes can you do? So squeeze, release, squeeze, release, squeeze, release. And then how well do you let go? So are you able to return to baseline, or do you still kind of keep some muscle tension there and it's difficult to relax and release? Now let's talk about palpating pressure. We did this some when we were doing the vaginal canal. Remember, we talked about that clock where you have 12 o'clock, 6 o'clock, 3 o'clock, and 9 o'clock. So 3 o'clock is going towards your left hip. And so we would do the same thing with the pelvic floor muscles, but you're wanting to get in there. Now, this model also really isn't anatomically correct, okay? Because I can put my finger in and I'm already inside the uterus. Most of the time, I mean, think about the length of a penis, okay? So a penis is generally not hitting that uterus, or, you know, it's able to get up there. So clearly this vaginal canal is short, but so most vaginal canals, you're going to be able to go all the way in. You're putting that finger in, and then we're checking the front. So lift up towards 12 o'clock. What's behind your finger when you go to 12 o'clock? It's the urethra, that bladder outlet canal, and then it's the pubic bone. So it's not going to be comfortable when you're coming up this direction, but it still gives you some information. Hey, is it painful? And it gives you a baseline of where you are. So if it's medium painful now, but then in 3 months, it's really painful, then maybe something's going on. And I would just go with the clock positions right now. So do your 3 o'clock, 6 o'clock, and 9 o'clock. And you're getting that finger in and you're hooking it. You're kind of hooking it and pressing that direction. So 3 o'clock, and then you're going 6 o'clock and 9 o'clock, or whichever, go right and left, 3 o'clock, 9 o'clock. Okay. But it's important for you to identify on yourself what is 3 o'clock. So for me, my left, if you think about a clock, it's just reversed when I'm teaching it, which is a little confusing. So left is 3 o'clock, right is 9 o'clock. However, if you superimposed a clock face on your vaginal opening, that's what you would do. And then you record what you find on there. So light pressure, deep pressure, is there any scar tissue, restricted movement? How's your sensation? Do you have good sensation, or does it feel numb, or is it very sensitive, difficult to touch? When you're pressing, are you feeling any referred symptoms somewhere else? So if you're in here and you're pressing, you're pressing towards your right hip, are you feeling it down into your leg or into your glutes or so forth? And then muscle tension and muscle volume. Muscle tension is easier to feel. So if you have a lot of tension, it's going to feel kind of like that. Like when you're in there and you're trying to press on that wall, it's going to feel pretty tense, kind of ropey. One other tip here that I think is helpful, if you think about the vaginal canal kind of like a champagne glass. So as you're going in, it's like this canal, and then it kind of opens up. And so it's almost like a shelf. And so you'll be able to hook your finger to that 3 o'clock or to that 9 o'clock. And it's awkward. I totally get it, because you're having to, can your hand do that? If not, maybe you use your other hand or possibly your thumb, or you go to see a pelvic floor PT to help you. But that gives you a very baseline of the deep pelvic floor muscles, the front. Now we would do similar deep pelvic floor muscles to the back, which again, this is up to you if you want to check, but this would be via the anal canal. Okay. And so you're inserting and you can get a better idea about what's happening. With checking with the anus, like if you put your finger into that rectum, you can actually get up and you can feel the piriformis muscle, this deep hip muscle. You have to know what you're feeling for. And I'm not suggesting that you do that. I won't prohibit you from putting your finger in your anus. If you want to put your finger all the way in your anus and feel around, that is totally fine with you, with me, and if it's okay with you. But you're doing that same clock. So the 12 o'clock, so 12 o'clock with the anus is going to be what? That's the vaginal canal, right? So 12 o'clock there, that's the vaginal canal that's in front of it. 6 o'clock with the anus is going to be your tailbone. So when people have tailbone dysfunction, that's actually one of the interventions that we do, is that we'll put a finger into the anus and we're grabbing that tailbone and we're manipulating. We can manipulate and move that tailbone where it needs to go. So my point here is be cautious. Well, be cautious with all of this, because that's why we want to have clean hands. We're never going from the anus into the vaginal canal or going up. Short fingernails, if you want to use gloves, fine. Making sure that you're using plenty of lubrication, making sure that you don't have any infections, any of the red flags, that you're not pregnant, and if you are postpartum, that you're cleared for penetrative sex. Okay. And so going to our little pelvic floor muscle tracker, this is our last section of pelvic floor muscles that we're going to be tracking. So you're feeling for light pressure, is it painful or not? Deep pressure, sensation, scar tissue, referred pain, and then also checking the squeeze. So you're here, which is really cool. You have a you have a pelvic floor muscle that literally slings around the rectal canal. So it kind of kinks the rectal canal to keep poop in. And then when you squat and you're ready to poop, that muscle kind of based on the position. So the squatting position helps that muscle kind of let go and helps the rectum, that anal rectal angle to straighten out so that poop can move through. So it's pretty cool. So checking your muscle power. Do you have good squeeze? Can you pull it up and in? What's your endurance like? How many repetitions? What are your quick squeezes like? And how well do you relax? Woo! I know that's a lot, but again, if you're having pelvic floor dysfunction, if you're leaking poop, you're leaking gas, you're leaking pee, you have prolapse, you have painful sex, any of those things, and there's, you know, other things that could be involved too, but this gives you a foundation towards recovery. It gives you a baseline of what physical therapists might be looking at, and I think that's empowering. So you go, let's say as a result of all of this, you decide to go in and see a pelvic floor physical therapist. Well, you're going to be an educated patient. You're going to have a lot of the right questions to ask. And it might even be a little intimidating to some people because you're learning some information that there's a lot of even pelvic floor physical therapists out there that may not have. So you have some secrets. I hope that was helpful. Print out that tracker and use it. So how often should you check? You know, this is really going to be very dependent on you. Certainly not less than every 30 days, because you're not going to see any tangible changes in 30 days. But you know, maybe every 2 or 3 months, if you wanted to recheck yourself, that might be a good time frame to do that. And now, as a result of all of the self-checks, so you're going to go through some more self-checks throughout this module, but at the end, then we're going to have these tables that are completed. For the most part, there'll be some sections that you won't have, and that's okay. But then we're going to look at these tables and we're going to have a much better sense of, are your pelvic floor muscles underactive? Are they overactive? Are they a mixture? Are they healthy? Are you doing, you know, are they functioning the way that we want them to function? So, and then the next module is intervention. So giving you some tools and some ideas of things that we use to help pelvic floor muscles do the right thing at the right time. Thank you for your time. See you in the next lesson.